Professor sir, I will give intro sir. Dr. Ravindra sir. Hello.
Yes, sir. Yes, sir.
Okay. Okay. Very good afternoon to all. Dr. Ravindra SV is the principal of MNR Dental College and Hospital, Sangareddy, with over 15 years of exemplary academic and administrative leadership in dental education. Under his stewardship, the institution has achieved remarkable academic success with postgraduate result reaching 99% and undergraduate result improving to 80%. A, a prolific academician, Dr. Ravindra has published 46 research papers with 147 citations, contributing significantly to achievement in oral medicine and radiology. His leadership has earned numerous accolades, including the Best Rural Service Award from Asia Pacific Excellence Award 2022, the IAB Blind Empowerment Champions Award in 2021, and the Excellence Leadership and Professional Development Award in 2024. Dr. Ravindra has championed community outreach by organizing free dental camps, school health initiatives, and geriatric care programs, benefiting underserved populations in Sangareddy district. He has facilitated collaborations through key MOUs with the international and national organizations, fostering academic innovations, research excellence, and community service. Driven by vision to transform MNR Dental College into a global leader, Dr. Ravindra integrates academic excellence with impactful public health initiatives, ensuring innovation and accessibility in dental care. No, sir, thank you so much, sir. Please take over this session, sir.
Thank you for your introduction, sir.
Okay, thank you, sir. Thank you, sir.
I think you are able to see my screen and
Yes, sir. Yes, sir. It's showing, sir.
I'm audible all too. Okay.
Yes, sir. Yes, sir. Audible, sir.
Okay. Very good afternoon, one and all. Thank the organizer for giving me this opportunity to present my scientific paper. So today I'm going to talk about non-invasive methods for the diagnosis of potentially malignant disorders of the oral cavity. So before I start, we'll know what is potentially malignant disorders. Oral potential malignant disorders are defined as a group of oral mucosal lesions with an increased risk of malignant transformation. These disorders include a mixture of diseases with different clinical appearance, histological subtypes, and risk factors, etiologies, and compromise various entities such as leukoplakia, erythroleukoplakia, oral lichen planus, oral submucous fibrous, and oral dysplasia. These are all potentially malignant disorders. So, why is it important to early diagnose? This comes the question. So, before overall 5-year survival rates are as low as 40%. If diagnosed in the early stages, that is first and second stage, survival rates can exceed to 80%, also increasing the survival rate from 40%. So this is the difference why it should be diagnosed very early. Then how? Development and use of diagnostic aids that would help and oral health care professions to readily identify persistent oral lesions of uncertain biological significance are essential to improve their ability to detect relevant potentially malignant disorders at their most incipient stage. So, diagnostic and detection of potentially malignant disorders, there are different types of modes. That is clinical methods, that is conventional, oral examination, and vital staining. Next is histopathologic methods, scalpel biopsy, then oral CDX biopsy test, cytology, laser capture micro dissection, and molecular methods like including immunohistochemistry, flow cytometry, and so on. And salivary diagnostic methods, in that protein and electrophoresis and salivarochemistry analysis. These are the different methods using saliva. Optic methods like Visilight, Microlex, well scope, fluorescence spectroscopy. Coming to imaging methods, there are different types of modes like CT, MRI, PET, and so on. These are the different methods in imaging methods. Coming to conventional method, as I told, tall in blue. This is the picture when we apply the toluidine blue. Extensively used as a vital stain for mucosal lesion, especially for components owing metachromatic property. The toluidine blue as a vital stain was first proposed by Richard to disclose dysplasia and carcinoma in situ of the uterine cervix. And how it is the mechanism of action. The toluidine blue has an affinity for nucleic acids and it binds to nucleic material of tissues with the high DNA and RNA content used for oral screening. And preparation, it is 1% concentration of oral application. 100 ml of 1% of toluidine blue consists of 1 gram and toluidine powder and 10 ml of 1% acetic acid and 4.19 ml absolute alcohol and 86 ml distilled water to make it 100 ml. The pH is usually regulated to 4.5. And coming to technique, how we are going to use as a oral screening. First, we have to rinse with water for 20 seconds to remove debris and apply 1% of acetic acid for 20 seconds to ropey saliva. This is followed by 1% toluidine blue application for 20 seconds either with a cotton swab when a mucosal lesion was seen or given as a rinse when no obvious lesion was detected. Again, after applying two rinses with 1% of acetic acid were performed to reduce the extent of mechanically retained stain. Finally, mouth is rinsed with water. And this is the interpretation based on, see, you can see this is the normal the mucosa which is having a lesion. So it is a potentially malignant lesion. And after applying the toluidine blue, you can see this intake of blue color. A dark blue stain is considered positive. Light blue staining is doubtful. And no color is interpreted as a negative stain. What are the indications? Detection of epithelial dysplasia, early invasive carcinomas, and assessment of tumor recurrence after surgical or radiotherapy treatment, intraoperative actions for marginal control of carcinomas. What are the advantages? It is a painless, low cost, easy to apply, and fast results, having high sensitivity. Disadvantage, it may generate false positive or false negative results as low specificity. Coming to leukocyidin, it is same as toluidine blue. Here, leukocyidin solution often used as an antiseptic and disinfectant for emergency disinfection of drinking water and as a reagent for starch detection in routine laboratory in medical care. These are different fields it is used, and these are the contents. And the principle, iodine reacts with glycogen in the cytoplasm and the reaction known as the iodine starch reaction is visualized by color change. And the tissue glycogen content is related to the degree of keratinization, glycogen content being inversely proportional to the degree of keratinization, because is very important. Because of glycogen, it is a plays as a key role in keratinization. This is an interpretation. You can see the lesion in the oral cavity, in the vestibular mucosa, and after the stain, you can see the color change, which is looking into brown. Advantages is easy and safe. Disadvantage, efficacy limited to non-keratinous. This is the only disadvantage here. Only non-keratinous mucosa can be detected. Coming to rose bengal, again, this is one of the staining. Here also, it is rinsed with the mouth with the distilled water to clean the lesions for 1 minute, and 1% rose bengal solution was applied with the cotton tip for 2 minutes, and patients are asked to rinse their mouth 1 minute with distilled water to remove excess rose bengal staining solution. Interpretation. Oral examination of location, size, morphology, and surface characteristics of the site stained and the intensity of the staining should be evaluated. After this, incisional biopsy can be taken and sent for histopathologic examination, and histopathologic grading of dysplasia and intensity of rose bengal staining can be correlated. A primary epithelial abnormality, that is dysplasia, metaplasia, virus, infected cells, or other forms of epithelial keratitis can be render the inability of epithelium to interact with the mucosal layer, thus allowing the rose bengal staining. Now coming to transepithelial, this is brush biopsy cytology. So this is developed in 1999. It is also commonly called as CDX, oral CDX. The image explains the methods of interpretation of a brush biopsy technique commonly used for sampling oral mucosal lesion. The left side picture diagram shows oral CDX brush instrument being used to obtain a complete transepithelial tissue. The brush is designed to reach all the layers of epithelium, that is superficial layer, intermediate layer, and the basal layer. The goal is to collect cells from entire thick of the epithelium. And on the right side, you can see the collected sample here. Potentially malignant or suspicious lesion. When invasive biopsy is not immediately required, it provides a minimally invasive diagnostic approach for cytological analysis. Coming to optical methods, that is called VisiLight. This is one of the most technique which is used on the chair side investigation. The working principle of VisiLight is based on chemiluminescence, which enhances the visualization of oral mucosal abnormalities. However, it works tissue pre-treatment, that is optional, because using VisiLight, the patient may rinse their mouth with a 1% of acetic acid solution. This helps remove surface debris and enhances the visualization of the mucosal changes. And secondly, the emission of, you can see in this diagram, the emission of chemiluminescence light, that is VisiLight, low energy, and blue-white chemiluminescent light. This type of light highlights the variation on the optical properties of oral tissues. Light reflection. Normal tissue appears darker area to the uniform light absorption and reflection. Abnormal tissue, that is dysplasia or lesion, appears brighter or more opaque because of this nuclear content, higher epithelial density, or changes in the tissue architecture. Visualization of abnormal areas. The clinician observes the oral cavity under the VisiLight, identifying the lesion may not be visible under normal light conditions. suspicious or can be bypassed for further histopathological examination. This is a diagrammatic picture. This is a visible light, chemiluminescence light, which is the reflection, which is the darker area is the abnormal area. That is we can suspect potentially malignant lesions. Coming to well scope, this is the well scope light with the blue excitation light, which is the top section shows an intraoral view viewed with unvisualized unassisted eye, where the lesion is not prominently visible. The bottom section shows the enhanced view using the well scope device, highlighting the suspicious area marked by a green circle. Here also, that exhibits darker fluorescence pattern. This lesion was later confirmed as a oral cancer. The slide illustrates the effectiveness of well scope in identifying oral lesions that may not be noticeable during routine visual examination. Wherever the fluorescent light is there, that is called abnormal. This you can see. Where the fluorescent light is normal, where the abnormal is not, it is a very lighter color. And this is the one clinical picture. That is what unviewed with unassisted eye. This is this thing. After we put the enhanced with using the light, we can see here the darker area. This is diagnosed as a oral cancer. You can see this darker area under the light. And coming to another this thing, confocal reflectance microscopy. This is another non-invasive tissue optical tool in cone reflectance microscopy with near histological resolution. You can see this diagram. So the laser acts as a light source, producing a focal beam of light for excitation, and scanning optics is there, guides a scan laser beam across the sample, and there is a objective lens here. Focus the laser on a specific point into the tissue sample, allowing precise imaging. This is a tissue sample, the target being examined, and the laser focuses on the specific focal planes within the tissue. The beam splitter reflects the laser light toward the objective lens and transmits the emitted fluorescence from the sample to the detector. Focusing lens helps to collect light from the sample and directs it to pinhole. This is the pinhole, and pinhole blocks out the focus light, ensuring that light from the focal plane reaches the detector. This improves image contrast. This is the detector, captures the emitted light to generate high resolution images. The diagram on the right side shows how the focal plane is precisely aligned with tissue sample for sectioned imaging. This is the fundamental mechanism behind the confocal microscopy, which allows for high resolution 3D imaging. Coming to nanobiotech, this is also one of the technique where we use in potentially malignant disorders. These are the advanced technique. This is the fluorescent imaging of cells is performed, capturing images of multiple fluorescent channels. Each corresponds to specific molecular or cellular targets, digital filtering and segmentation, nuclear mask, cytoplasmic mask. The segmentation separates nuclear and cytoplasmic regions. Paired nuclear, you can see paired nuclear cytoplasmic ratios. Combined masks for nuclear cytoplasmic regions are overloaded to identify the analyze individual cells. And this is also called as another promising tool for oral cancer detection and is autofluorescence spectromicroscopy. This system consists of a small optical fiber which produces various excitation wavelengths and a spectrogram which receives and records on a computer and analyzes it with the help of software, the spectra of reflected fluorescence from the tissue. It has a high sensitivity and specificity and also has a non-invasive aid in the detection of various alterations in structural and chemical composition of cells indicating the presence of a diseased tissue. And autofluorescence microscopy consists of the emission of light in the UV visible near IR spectral range when biological substrates are excited with the light at a suitable wavelength. This technique is useful in guiding the clinician in identifying the optimal location for biopsy. This is important. And this is how the principle it works. Coloscopy, it is also mucosal lesion, helps in selecting more representative sites for biopsy than routine clinical examination alone. It is an important diagnostic tool, help in evaluation monitoring of malignancy because of its precision, versatility, ease of use, and being a non-invasive technique. It allows examination of oral tissues in situ at a high magnification with good resolution. This is because of the instrument allows simultaneous viewing of surface cells of submucosal vessels. And this is the most, now we are into a digital world, we call a digital dentistry now. Now so many things have been, advanced techniques have come, and this is a oral scan, handy. This is very handy for oral screening. So it is made in India, and startup Sasan Meditech incubated at TIM, the technology business incubator of Sri Chitra Tirunal Institute of Medical Sciences and Technology, Thiruvananthapuram. This credit goes to these people who have done this startup to improve our dentistry field. And this innovation will make screening, detection, and biopsy guidance for oral cancer easier, quicker, and simpler. And lastly, this is saliva-based oral cancer diagnostics. That is molecular imaging, DNA ploidy, and tumor markers, biomarkers, and PCR-based diagnostic aids. These are the things which we are using most commonly to use potentially malignant disorders, which is very helpful. Before only the conventional methods were there. Now so many advanced technology are there, which is non-invasive methods. And lastly, I thank for giving me the opportunity to present this my scientific paper. Thank you very much for the organizers. Thank you.
Thank you, sir. Very nice presentation, sir.
Thank you.
So much. Any questions from audience? Audience? Any questions from audience? Okay, thank you, sir.
Okay. Thank you.
Yes, sir. Thank you so much, sir. Okay, afternoon session. Please put your article number, abstract number. Please put it in chat box. 11 to 20. Abstract number 11 to 20. Please put it in chat box. Feedback also